Hi, everyone. I'm quite pleased today to have Dr. Suman Chakrabarti with us again. And Suman has been very generous with his time and has been with us a few times to help us through these the difficult times during the pandemic. So Dr. Chakrabarti is an infectious disease specialist with Trillium Health Partners in Mississauga, Ontario, and he's a Sarnia native, actually. So great, welcome back, Suman. Good to see you again.
Oh, thanks for having me. And it's always great to talk to the hometown crowd. So it's great to be here.
Thank you. I want to pick your brain a bit about the latest in COVID-19, and everyone is being bombarded by information from all over the place, up and down the information highway, basically. And just to lay down a bit of a background of what's happened in our county anyways, we have 120,000 people here, and about 3,600 people had COVID-19 over the past year and a half. In our hospital here at Blue Water, we treated about 260 COVID patients, of whom, unfortunately, about 52 passed away from the disease. So roughly 8% of the population who had COVID got admitted, and about 20% overall lost the battle with it, which is in line of what's been happening throughout the nation as well. Having said this, the population here has done a great job in terms of following public health guidelines and advice, all the way from very tough lockdowns, which were hard on a lot of people, well, everyone, I would say, affected both adults and kids, schooling, everything, businesses, etc. But finally, this summer, we're seeing some a glimmer of hope and light at the end of the tunnel. As you know, provincially, we're now in phase 3 of the reopening. Businesses are reopened again. The case load numbers in our county are fairly low, less than 4 per 100,000. And the hospital is finally, basically, we don't have any active COVID patients anymore, as opposed to the dozens of patients we had at the heights of the various waves. Having said this, we are, as we look at our better numbers, our neighbors in the south are noticing an increase in numbers in the southern states, especially. Our friends in the UK are seeing an upswing again in Delta wave. So what's your feel about what potentially we might be seeing over the next few weeks or months?
Yeah, this is the question on everyone's mind. And look, I think there's no doubt that we're going to be seeing an expansion of cases in the coming months, whether it's just from our reopening, which we're seeing in many of the European countries, but also just because, as the colder months come, you're going to see people on average huddling more inside. And this is what happens, the nature of the respiratory virus. I think one of the biggest things to see, even with UK, even though we're seeing that cases are going up really high in that area, we are not seeing the same type of reflexive rise in hospitalizations that we saw in previous waves. And that's huge. Now, that said, we still have to keep an eye on things because it's a lagging marker. But, looking at the entire picture, the trajectory is much less. And this is showing us that what's happening right now is that the vaccine is working. We're seeing primarily unvaccinated individuals getting sick enough to be hospitalized. And that's still something that we have to reckon with here as well. But the fact that vaccines do work, and this is a fundamentally different disease. And I think that's not something that's really being pushed out in the messaging. There's a lot of fear and trepidation. I understand why people are concerned, but I think we have to look at the entire picture, and vaccines are a huge part of that.
Speaking of vaccines, as you know, we have about almost 80% of our local population had received at least one dose, and about 60% have received 2 doses already, which is great, and also aligned with the rest of the province as well. Having said this, there's this a lot of information about efficacy against Delta, and what I've seen so far is still the numbers are holding up well. Maybe not as perfect at 95%, but 88 to 90% against Delta. Is that what you're seeing as well or reading?
Definitely. I think the narrative came out that one dose of vaccine didn't do anything. That's certainly not true. If you looked at the real world data that came out of Britain, we were seeing somewhere of 94%, even with one dose of Pfizer, generally for 14 days afterwards, and 96% efficacy. So, and this is both against hospitalization. Now, yes, it is less efficacious when it comes to symptomatic disease, but that's one of the biggest things to look for is that, let's say if I get vaccinated and I am symptomatic with COVID, if I'm exposed, but those symptoms are, a little bit of sneezing, a little bit of coughing and a fever for a day, I can live with that as opposed to somebody getting hospitalized with them. That's what the big thing is, 94 and 96% efficacious at preventing hospitalization. And that's huge.
Uh, can you comment on the occasional, albeit not as common, but nevertheless, there's somewhat what's called a vaccine breakthrough. So someone who's been vaccinated who ends up being positive. Some have no symptoms at all, which I would say that means the vaccine did something. But some actually are getting ill. And can you comment on actually who is getting ill, who's been vaccinated in the past?
Absolutely. So first of all, vaccine breakthrough is by definition when somebody has had both doses of vaccines, you're 14 days after the second dose, and you are tested positive for COVID. And I like to take that a bit farther. I like to call it breakthrough infection of concern. What bothers me is if somebody gets both vaccines, they're exposed to COVID, and then they get sick enough to be hospitalized. And those numbers are extremely small. We're talking about less than 1%. I forget the exact number. Dr. Haddad, you probably have it there somewhere, but it's a very small proportion. And remember, when we see these cases, the majority of people who have COVID after being vaccinated fully are having very minimal symptoms, if any symptoms at all. For example, look at the New York Yankees, that a bunch of people that are positive, half of them didn't even know it. They had COVID. So I think that's really important. And what's also important to look at, don't look at the people who you're testing positive. Think about the massive number of people who have been vaccinated fully. They're getting exposed in the community and they have no idea they have it. And that is the type of virus that we live with on a day-to-day basis, even before COVID.
Thank you. And my understanding also is some of the truly breakthrough with symptoms or getting ill after vaccination are also noted to be adults who have fairly severe illnesses or immunocompromised. Their immune system is not strong enough to actually mount a response to even the vaccine. And it seems to be less than 1% of the total admissions. I know from US data, 99% of their admissions with COVID, sick enough to be hospitalized, seems to be among the unvaccinated, unfortunately.
That's a very good point. And this is what we expect as well. People that have a lot of comorbidities, especially immune compromising things, they may not react to the vaccine as effectively. And that's a very good point to make.
And there's all this talk now about maybe a third shot for some of the immunocompromised populations, like transplant patients or cancer patients, things like this. That's being discussed anyways in the field. Now, looking into the fall, and I have a feeling, or talking to many people, and what we're seeing is that it's going to be hard to go down to so-called like sort of a zero cases. We'll have to live with this somehow, but we still have to reduce the risk by, at least reducing the number per 100,000, for example, and still have some mitigating issues in the community and public health measures aside from vaccination. The big thing on people, the big issue on everybody's mind now is, and I have kids of my own, less than 12 years of age, we can't vaccinate them yet, and schools are hopefully opening in the fall, hopefully, right? And that affects our kids, both from education and social growth standpoint, and also the parents who need to go to work as well. I mean, it's all connected. So what's your feeling, and in light of the Science Table's latest publication yesterday or a couple of days ago about guidelines or advice to the government?
I think those guidelines that came out from the Science Table were exemplary. They're very good, looking at balancing risk. I think that we've had a laser focus on COVID for the last year and a half with lots of justification. But things have changed now because the vaccines have allowed us to defang the virus for the vast majority of the population. We now have the ability to look at other risks and benefits. It is a huge benefit, and it's absolutely crucial that our kids are back in school with zero interruptions over the next, forever now, hopefully. And I think that it's very important for them to be in class. I like the way that the guidelines from OST, the Science Table, have graded the risk. So if you're in a high risk, high burden setting, then things like physical distancing and masking should be considered and should be done. But in lower risk settings, you don't necessarily need that. But for people that are worried, if you want your kid to wear a mask, they can. But I also want to remember that when adults and individuals who are over the age of 18, when they are vaccinated in a high amount, the number of cases drop in kids and adolescents as well in the absence of vaccine. So these things are things that need to be considered as well. And finally, remember that even though kids can get COVID, the vast majority of them are almost minimally or asymptomatic. They don't get very sick from it. There is the occasional rare case that you do find out, but the majority don't. And I think when you put all of these together, I think it's much more important for kids to be in school without any interruption, and it should be in person starting in September.
So the advice we're hearing from public health is vaccinate as many adults as you can, even in 90% if that's possible, to protect the kids because they can't be vaccinated below the age of 12. And this way you keep the case numbers low, and that would be protective for the kids until one day maybe they can be vaccinated. Having said this, when we mention this, there are still some parents who are hesitant, and they quote or are worried about something called the long COVID, or if you get COVID, you might be stuck with some symptoms for a long time. There was a paper published a couple of days ago showing that most of the symptoms resolve within 12 weeks, and they're not as serious, but or not as common. But again, what's the latest in the infectious disease world data?
So long COVID is something that I really want to caution people on, that we don't have the full extent of what it is yet, but it isn't likely what people are thinking it is, that you get COVID and you get these symptoms for the rest of your life. It certainly isn't that. We do know with other viruses and with COVID that people can have some symptoms after they improve, things like a post-viral cough, post-viral fatigue. And the majority of patients that have this, it lasts for no longer than 6 to 8 weeks. I've seen 3 months as well, but it eventually all goes away. The idea of long COVID, having lots of these, non-specific fatigue, foggy brain, difficulty concentrating, all this stuff for a long period of time, they looked at studies and look at kids that have these, that have had COVID, but they also found these exact same symptoms in children who haven't had COVID. So these are kind of common symptoms, many of which might be because of the lockdown itself, but they're commonly found in individuals. And I think the idea of a huge number of kids having symptoms for the rest of their life because of having a bout of COVID is very, very unlikely. So I think that just to remember, COVID, yes, it is a virus that we have to contend with, but one that does not affect kids nearly as severely as it can in especially older adults. The majority of the kids don't even know they have it. Long COVID is something we need better study in, but I think that the idea of this causing widespread symptoms for the rest of their lives in kids is very, very unfounded right now. And the data is showing that this is not the case at all.
Is it possible for a child to get long COVID without exhibiting initial symptoms of COVID, like asymptomatic?
I suspect not. The usual, we see kids that have post-viral syndromes, they've been symptomatic, and the studies are showing that this is very, very unlikely as well. But that said, I understand, I don't want to trivialize people's concerns, because I get that COVID's a new thing. We want to protect ourselves from it. But that said, from the overwhelming amount of data that we're getting from here in Canada and around the world, kids half the time don't even realize they have COVID, and they go on because their immune systems are able to deal with it very, very effectively without causing any severe symptoms.
Coming back to adults, I have to admit, I've seen a lot of adults with COVID disease, and luckily the overwhelming majority improve. We've lost a few, of course, unfortunately, but we do see some long COVIDs even a year later. With pulmonary disease, shortness of breath, weakness. So they feel weak and fatigued, and they can't do as much as they can. So that I understand still needs more research or understanding over the next while, I guess. The last question I have for you is, again, pertains to children, because I have to admit, we're getting a lot of questions about this from staff who have kids and they must send them to school and they're worried. The balance from what I've read and what I've been told by experts is that between the ages of 12 to 17, the adolescent years, the balance is still better to get the vaccine to protect yourself from COVID, because COVID by itself would cause a lot of different things, including myocarditis, for example, inflammation of the heart, or pneumonias and things like this, albeit not as common as in adults, as you just said. But nevertheless, there's been some incidents also with the vaccines themselves causing inflammation of the heart, myocarditis, or pericarditis, and mostly resolves. But nevertheless, and there's a lot of debates or discussions about the frequency. Should you wait a bit longer between first and second dose, or is it the dose itself that should be reduced? And there's a lot of research about this. Like, where do we stand now?
Yeah, so I have kids of myself. They're young, so I understand how parents feel. That's a very good point. And the idea of the risk of something coming from the vaccine has to be balanced in the real world risk of what's happening. I think a couple of weeks ago, we still are concerned about the possibility of myocarditis, especially in younger men and boys with the second dose. And if you have a very, very low risk of hospitalization, it makes sense. Is it really worth getting that second dose? But now, as we're starting to see what's happening around the world, in the UK, with cases spiking, especially in the younger groups, from a population level, it actually probably now does make sense to get the kids vaccinated when it's the opportunity presents itself, just because in terms of overall transmission in the community, keeping things down and keeping this into an endemic situation where we don't see massive spikes in localized areas, I think the overall calculus now does suggest that getting that second dose, even with a tiny risk of myocarditis, is probably warranted. I would have given you a different answer a couple of weeks ago because we weren't sure what was happening, but it does look like now that Delta does like to seek out unvaccinated populations, both causing disease in them, but then this can lead to widespread transmission as well in the community. So that's kind of where we are at right now. And this information is always going to be evolving, and we try to keep on top of this and give you guys the information where we can.
Thank you. One of the big differences I found in terms of vaccination, population vaccination between us and the UK, and I compared the UK because of their Delta wave now, is they haven't vaccinated their 12 to 17 years as well. And most of the infections seem to be in less than 30 years of age, sort of in that younger category. One last thing, because is the risk of transmission among fully vaccinated. Seems to be a hot topic as well. There's many studies showing a reduction in the viral load in the nose, for example, and things like this. And there's many studies, including a recent one showing from Israel, reduction in transmission. But still, many people say, "Oh no, you can still transmit if you're fully vaccinated." And so, what's the feeling about this from the virology experts and infectious disease experts?
Yeah, so we know that the risk of transmission is significantly reduced, but not completely. And I think this is a situation where we have to kind of consider your own risk benefit ratio for yourself. You know, if you're going to say, if you have you're 70 years old, you're fully vaccinated, and you're going to an indoor wedding with hundreds of people inside, yeah, you may want to consider wearing a mask. Or you don't necessarily have to. I think the point for us to remember is that this is something that we know that we're not going to get perfect reduction in transmission, but the risk is significantly reduced. And when you have a number of people in the area, all of whom have also been vaccinated, it makes a difference. So this ends up becoming a personal risk assessment. I do think we're going to still be seeing people wearing masks indoors, even if that mask mandate is lifted. And that's a choice that you have to make yourself. But I think that the big thing for us to remember is that with vaccination, let's look at the glass half full. We have such a huge difference compared to what we had last year in terms of risk reduction, not only for yourself, but the people around you as well. And I think that as time goes on and you have less and less COVID in the community, it's not going to be gone, but the risk is going to be akin to what we had, let's say, before COVID with something like influenza. We have to come to terms with that, but we can do so in a safe way thanks to vaccination.
And I assume regardless of all these variants that keep popping up with different names, as long as they don't evade the existing vaccines, we should be basically treating it all the same.
Exactly. And the thing is, as we know, as pandemic viruses evolve, they start to get more and more transmissible, which is probably not going to happen much more, but they also get less and less virulent as they make their way to become an endemic virus. So yeah, it seems like we've had a lot of variants, but we're unlikely going to get some super variant that's going to, really rip through the population in a bad way. It's likely going to be something very, very contagious and mild, like the common cold.
Well, thank you. So a lot of information, but truly appreciate your expertise in the field, and thank you so much.
Always a pleasure. Always a pleasure.
Chakrabarti, and great. Thank you, everyone.